Many times people have asked me directly or even on my social media pages, why is it that I believe that children should go to school? And why is it that many others, not only myself, the government, other agencies believe that children should be in school? The one thing that we don't disagree on is that school is the best place for a child. That one we don't disagree. I think the risk and the fear that I see is related to what happens when the children go to school and they get infected. So there are two ways to look at this. The first thing is to say, number one, how do we reduce the risk of infection? Remember, the risk of infection, whether at home, in the playfield, or in school, will never be zero. So how do we reduce the risk of infection? Just like we do at home, by ensuring that parents and other caregivers don't go and expose themselves and bring the virus home, we must also work with schools and ask ourselves, how do we reduce the risk? And we've said clearly that schools need a good protocol to ensure, one, there is hand washing with soap and water. Secondly, children who are of age can wear masks as much as possible. And thirdly, that we create space and ventilation in the classes. And finally, that where it's possible, we reduce contact time between students and teachers, because the more time that people spend together, they have the risk of infection. So these are things that the Ministry of Education, whichever country, will be looking at to ensure that these measures are taken. And we know they will not be perfect. That's the other thing we must always remember, that they will not be perfect and there will be no time that they will be perfect. Then we look at the other pocket of evidence that when and if children get infected, the world over, the risk of severe disease in children is extremely low. In many places, it is rated as 0.0003%, where it is about 16% for people above 80 years. It is actually age-related, and it is lowest in children and highest in the elderly. So we must remember again, therefore, that infection does not mean severe disease. Infection does not mean illness. That children and adults will get infected without getting ill. So we must also remember that children have the lowest risk of severe disease. So even as we call for them to go back to school, it is because we know the risk of severe disease is so low, it is outweighed by the benefit of the child being in school, because many of them may actually have more harmful impact when they're out of school because of lack of food, because of teenage pregnancies, because of low social development of the children. So this is why we are saying that children need to be in school, recognizing the risk is very low. But there is the other element of when the children go back to school, to school, and then they have to go home. When the children are in school and they get infected and they have to go home, then the people who live with the children have to then ask, how do we minimize the risk of the infection coming back? We will do exactly the same as we do when, people who are breadwinners leave us at home and they go to work to the market and they go to their office to work because we need to eat. The risk of that person coming back with the infection is no different from the risk of the child coming back with the infection from school. So just the way we have actually determined that lockdowns are detrimental to people's livelihoods, is the same way we should be ready to agree that school closures are detrimental to children's lives. So we must then take the risk of bringing back the virus the same way we look at it when we allow the breadwinner to go out, and take the same measures we need to take, which is wearing masks when we are out there. That's why we're asking children to wear masks, and washing our hands with soap and water when we are out there, which is exactly what we are asking the children to do. The final point we need to deal with is, so when children are in school and one child is positive, what next? This is a critical question, because I think what I have seen is that when there's a positive case, panic reigns in the school. Let us explain a few facts. That one, the risk of infection in school is not zero. It will happen, meaning that schools must be prepared that there will be positive cases. And therefore, when the positive cases occur, it should not be panic, it should be preparedness. What kind of preparedness and what kind of protocols do we need to follow? First, if you find a child is positive, then you first must ask, how did you find the child is positive? One, it is either the child was unwell, in which case that child should have actually been isolated and at home, because we know that people who are sick have been advised not to go to public, or because maybe there was a testing activity in the school, or there was a contact tracing. So the first thing the school should do is, if you have a positive child, is calmly isolate that child, talk to the family, and find out whether they're able to isolate that child at home. We have home-based care in the country. There's a protocol for that. So the first step is the family able to maintain home-based isolation for that child, or does that child require home-based isolation elsewhere? Not because they're sick, but for us to avoid them transferring the virus to other people. That's the first thing. Secondly, contact tracing. Who has been in contact with this child? You contact trace as we would in the community, and if you find there are people who are in contact with the child, you can do one of two things. One, you can ask all the people who are in contact to quarantine themselves, either in the school or at home, depending on whether it's a boarding school or a day school. Again, without panic, just say the following people will segregate part of the dormitory and we'll make this a quarantine center. Not that they are sick. They need to be monitored, yes, but they should just be quarantined to ensure they spend 10-14 days on their own to ensure that the period for them to infect others passes. But they will probably not be symptomatic or sick. The next thing you can do is, if any of them is sick, then you'd follow exactly the same protocol as we follow when we are a household member or a community member who is sick. Meaning, call the hotline and have that person attended in a hospital or a health facility. So what we really need to do is avoid panic in schools. We need to avoid closures of schools when we have 1 or 2 or 3 or 4 cases, so that we do not create panic. We need to follow normal protocol. Positive person, isolate, contact trace. After contact tracing, quarantine or test those people. If they are positive, isolate them, but let the rest of the school continue, but ensure that you embed good discipline and persuasion to ensure the public health measures are always followed. Wash your hands with water and soap, social distance, and also wear masks. This is what we need to do, not create panic, but ensure schools continue and we do not interrupt them every time we find a positive case. Remember, the risk of severe disease in young children under 19 or under 18 is very low, not only in Kenya, but globally. And that is why we advise that the best place for young people is in school, following the necessary measures.